Ch22 personality disorder, part 1. Personality is defined as the totality of emotional and behavioral characteristics that are particular to a specific person and that remain somewhat stable and predictable over time. Personality traits may be defined as characteristics in which an individual is born or develops early in life. They influence the way he or she perceives and relates to the environment and are quite stable over time. Most common personality disorders are impairment in interpersonal relationship functions, which is 41%, dysfunctional in cognition, which is 30%, affective, 18%, and impulsive control, which is 6%. So personality disorders occur when these traits become rigid, inflexible, and contribute to a maladaptive pattern of behavior or impaired cognition. Personality development occurs in response to a number of biological, psychological influences such as heredity, temperament, experiential learning, and social interaction. First recognition that personality disorder, apart from psychosis, were cause for their own concern was in 1801, with recognition that an individual can behave irrationally even when the powers of intellect are intact. 10 specific types of personality disorders are identified in the DSM-5. They fall into 3 clusters. The first cluster is behaviors described as odd or eccentric. Second cluster, behaviors described as dramatic, emotional, or erratic. Third cluster, behaviors described as anxious or fearful. Paranoid personality disorder can be characterized by persuasive, persistent, inappropriate mistrust of others. Individuals with this disorder are suspicious of others' motives and assumes that others intend to exploit them, harm them, or deceive them. The disorder is more common in men than in women. Paranoid personality disorder continued. The clinical picture could be possibly consistently guarding of self, hypervigilant, ready for any real or imagined threat, trust no one, constantly test the honesty of others. Clinical picture continued for personality disorder. So this person may be oversensitive, however, insensitive to others. They may tend to misinterpret minute clues, magnify or distort clues in the environment, does not accept responsibility for his or her own behavior, and attributes shortcomings to others. Predisposing factors, possible hereditary link, subject to parental antagonism and harassment. Schizoid personality disorder, characterized primarily by a profound defect in the ability to form personal relationships, failure to respond to others in a meaningful way or a meaningful emotional way. Schizoid personality disorder occurs more frequently in men than in women. The prevalence within the general population has been estimated to be between 3 to 5%. Schizoid personality disorder, clinical picture continued. So the patient may be aloof, indifferent to others, emotionally cold, no close friends, prefers to be alone, appears shy, anxious, or uneasy in the presence of others, inappropriately serious about everything, or has difficulty acting in a lighthearted manner. Schizoid personality disorder, predisposing factors. So there's a possibility of a hereditary factor, However, it is also believed that if a child is brought up in an environment where the interaction was cold and unsatisfying, that the child may develop this schizoid personality disorder because the child's characteristics may be bleak, cold, unempathetic. They may lack nurturing as well. Schizotypal personality disorder. So individuals with schizotypal personality disorders display odd, eccentric behaviors, but not to the level of schizophrenia. So schizotypal personality is marked by symptoms that look like schizophrenia more than those of the schizoid personality. So clinically, these people may present with, they may be isolating themselves, aloof, behave in a bland or empathetic way or manner. Clinical picture of schizotypal personality disorder. Symptoms may include magical thinking, ideas of reference, illusions, depersonalization, superstitiousness, withdrawal into self. Clinical picture continued, so they may exhibit bizarre speech patterns when under stress, may decompensate or demonstrate psychotic symptoms, demonstrates bland or inappropriate affect. Predisposing factors, possible hereditary factor, early family dynamics could be a cause as well. So indifference, impassivity, formality, leading to a pattern of discomfort with personal affection and closeness. Antisocial personality disorder includes a pattern of behavior that is socially irresponsible, exploitive, without remorse. This behavior reflects a disregard for the right of others. The personality disorder clinical picture, the client will present with fail to sustain consistent employment, fail to conform to the law, exploits and manipulates others for personal gain, fails to develop stable relationships, more common in men than in women. Personality disorder, characterized by patterns of intense, chaotic relationships with affective instability, fluctuating and extreme attitudes regarding other people, highly impulsive. Borderline personality disorder, emotionally unstable, directly and indirectly self-destructive, lacks a clear sense of identity, affects about 1 to 2% of the population, more common in women than in men. Histrionic personality disorder behaviors could be excitable, emotional, colorful, dramatic, extroverted. The prevalence is thought to be between 2 to 3%, more common in women than men. Chronic personality disorder clinical picture may exhibit manipulative behaviors. They may be exhibitionistic. They may be seductive, overly gregarious, attention seeking, self dramatizing. Continued. So highly distractible, difficulty paying attention to details, easily influenced by others, difficulty forming close relationships, strongly dependent, somatic complaints are common. Predisposing factors are possible links to noradrenergic and serotonergic systems, possible hereditary factors, biogenetically determined temperament, learned behavior patterns. Narcissistic personality disorder, characterized by an exaggerated sense of self-worth, lack of empathy, ineligible right to receive special consideration. Prevalence of the disorder is estimated between 1 to 6%. diagnosed more in men than in women. Narcissistic personality disorder clinical picture continued. So overly self-centered, exploits others in an effort to fulfill one's own desires. Mood which is often grounded in grandiosity or usually optimistic, relaxed, cheerful, and careful. Picture continued. Because of the fragile self-esteem, mood can easily change if a client did not meet self-expectations, receive positive feedback that they expect. Criticism from others may cause them to respond with rage, shame, or humiliation. Predisposing factors to narcissistic personality development. So, in childhood, fears, failures, dependency, needs were responded by criticism, disdain, or neglect. Parents were often narcissists themselves. Parents may have overindulged the child and failed to set limits on inappropriate behavior. Avoidant personality disorder, characterized by extreme sensitivity to rejection, social withdrawal. Prevalence is 2 to 3%, equally common in both women and men. Clinical picture for avoidant personality disorder includes an awkward, uncomfortable in social situations, desire close relationships but avoid them because of their fear of being rejected, perceived as timid, withdrawal, or cold and strange, often lonely and feel unwanted, views others as critical and betraying. Avoidant personality disorder. Predisposing factors. No clear cause is known. May be a combination of biological, genetic, and psychosocial influences. Primary psychosocial influence, parental rejections, and censor, which are often reinforced by peers. We have ourselves a question. When assessing a client with narcissistic personality disorder, the nurse expects to identify which characteristic behavior. A. Odd behavior and magical thinking. B. Grandiose sense of self-importance. C. Pattern of intense or chaotic relationships. D. Submissive and clinging behaviors. I'll give you a second. You are correct. The answer is B. The client diagnosed with narcissistic personality disorder may have exaggerated sense of self-worth. They often have feelings of grandeur or grandiose ideas of themselves.